Welcome to your virtual prehab class. My name is Ashley Wilson, and I'm a physical therapist here at the WellSpan Surgery and Rehabilitation Hospital. I invite you to scroll through this presentation and listen and learn along the way as you begin your journey for your new joint replacement. Today, I would like to go over any precautions you may have for your new joint replacement, how to prepare your home prior to coming into the hospital, and what to expect while you're in the hospital. I know you may have a lot of questions coming into surgery, and hopefully we can answer a lot of them during this presentation. As you prepare for surgery, please complete the home safety checklist. This is located in section 6 on page 29 of your joint replacement binder. This area is great to get you thinking about your new joint replacement and what modifications you may need to do to your home prior to surgery. As we think about going home, you most likely will be on a rolling walker. So navigate your house as if you were using a walker. A walker is a little bit wider than your hips, and you may need to navigate around the bathroom, the powder room, your bedroom, hallways, kitchen. All of these locations in your house, make sure they are open areas where a walker could fit through. If you have an area that is narrow and need to practice, we may be able to teach you how to sidestep with a walker to make that area accessible. For those of you who are having a total hip replacement, your surgeon may perform a posterior lateral approach. In this case, you will have the following hip precautions. You will not be able to cross your legs even at the ankles. You will not be able to flex or bend your hip greater than 90 degrees. So this means you cannot reach below your knees or have your knee higher than your hip if you are sitting. We do not recommend you sit on low chairs or toilets. These precautions are put in place to protect your hip joint. Additionally, for your total hip replacement, we do not want you to excessively internally rotate the operated leg. So this means do not turn your toes in towards the center of your body. Finally, do not twist on the operated leg. So if you're walking and you want to reach something that's outside of your base of support, make sure you turn, take small steps and face the object. Go ahead and grab that object and then turn and take small steps and face the other direction. If you are having a total knee replacement, you may have specific time frames of how much knee flexion or how much your knee can bend during your recovery. Please follow the guidance of your physical therapist who is in contact with your surgeon as you recover from joint replacement surgery. Having a throw rug by your door or even by the stairs is always nice curb appeal, but unfortunately, when you go home on a walker, it is a high fall risk area. As you walk with your walker, the wheels in the front of the walker may glide nice and smoothly over the rug. Unfortunately, as you walk past the rug, the posts in the back tend to catch the edge of the rug, and your walker and yourself may go tipping forward. We recommend that you remove all throw rugs prior to surgery. If you have rugs that have anti-skid on the bottom and do not move, those would be okay to keep around. But like I said, if you can remove your rugs, please do so. The last thing we want you to do is fall after joint replacement surgery. In this slide, it shows various chairs in your house that you may sit in. Before surgery, think about your most comfortable chair, where you primarily sit. After surgery, some things such as low surfaces, higher surfaces, they might be harder to get in and out of at first, and you might have to readjust your surfaces for the time being. So the first chair here on the left, it looks like a kitchen chair. The only thing that would make this chair easier to get in and out of would be if it had armrests. So anything you can push up from a higher surface will make that transfer to get to standing a little bit easier. The second chair with the ottoman, we recommend something of this sort with either an ottoman or a recliner chair that when you're resting at home, you can keep your feet elevated. After surgery, you tend to get a lot of swelling in your lower leg if your feet are down or in a dependent position. So throughout your stay here at the WellSpan Surgery and Rehab Hospital, we will keep your feet elevated when you're outside of therapy in the recliner chair. The rocking chair there on the far right, we don't recommend anything that moves as you would go to sit in it. So rocking chairs, even some recliners, move a little bit when you go to sit, so be cautious of those. When you reach back, you want to reach for something stable. So reach for those armrests that you know will be stable and you'll be there. Balance is definitely impacted after surgery, and we want to prevent anything that would put you at a risk for falls. On the bottom, the sectionals are great to sit in. It's nice to prop your feet up. As long as you don't have any problems getting in and out of the sectional, we can recommend that. So that piece where it has the X, the blue X, we don't recommend just because it's hard to get back and into that L section. With all chairs, remember, if you're having a hip replacement, think about your precautions. If you think about chairs you like to sit in now and they're significantly lower, you might put your hip at risk for sitting in those low surfaces. So think about, can I boost up the surface with, say, a pillow or a couple rolled blankets or something a little bit higher so I can still sit in that chair that I love to sit in, but that my hips are higher or even with my knee. A lot of times people ask me, well, can I sit in a recliner? Yes, you can sit in a recliner. As you sit in that recliner and your chest goes back, that angle between your thigh and your chest is getting wider. So you are allowed to do that. We get concerned when your chest and your thighs get closer together. That's when we're impacting those hip precautions. Now, if you have a total knee replacement, remember, pain is going to be your limiting factor. So low surfaces, you might be able to get into a little bit easier. Sometimes pain will impact that, and that's when you would need a little bit of a higher surface. All of these things, all of these items, the chairs, the bed, we will practice when you come in for surgery. So if you have any questions or concerns, go ahead and take some measurements, see how high your surfaces are, jot them down in your joint binder, and then let us know your questions or concerns when you come in for your session. When we think about storage, we think about the kitchen. If you would need to be independent in the kitchen, those most used items, say you like your cereal every morning, or you like to cook your egg every morning, keep those items you use frequently waist to shoulder height, so they're easily accessible. Things such as the drawer under your stove, you may not be able to access as easily as you once did right after surgery. So if you need to pull a pan or a tray out of that drawer and keep it on the countertop for the time being after surgery, please do so. We want to set you up for success when you go home. So think about your kitchen as well as the closet. So if I think about where I keep my shoes are on the floor. Maybe you need to bring your shoes up, put them on a chair for the time being so that you don't have to reach down towards the floor every time you need to grab your pair of sneakers. After surgery, it will be important that you have nutritious meals. If you are the primary cook at home, make sure you start planning now. So make crock pot meals, large stovetop dinners, large casseroles, and then freeze half of them. Put them in single serve or family serving containers in the freezer so that after surgery you can pull them out, pop them in the microwave, stick them on the stove, and have a quicker meal. You will be able to stand and cook and make small meals, but those large 5-course dinners will be on hold for a bit of time. If you have any animals, think about who is going to watch them, who can care for them. After your joint replacement, walking your dog or say bending down to change a cat litter box or maybe get them food might not be ideal right after surgery. So you might need some assistance with that. You could raise things up a bit. So if you can put things on the low stools or even chairs so that you don't have to constantly reach down to the floor, this might be your best bet. Here it is. It's the day of surgery. You walk into the building. The receptionist will show you where to go for the surgical waiting room. They take you back. You're prepped for surgery. You have your surgery. You're sitting in the PACU, and then you go to the floor. It's a revolving door this first day you get to the floor. So you'll be greeted by your nurse. You will see a respiratory therapist who will give you a spirometer, have you do some breathing exercises. You may see a hospitalist who's like your family doctor here. They will go over any of the medications. And then you will have one of us from physical therapy come, and the plan is to get you out of bed with assistance. So this might involve sitting on the edge of the bed. It might involve standing up, pivoting, sitting in the recliner. You may even take a walk into the bathroom. You might take a walk into the hallway. Everything is individualized. So based on how you're feeling is what we will accomplish that first day. We like to go over how to use your walker, how much weight you're allowed to put on your leg, and any precautions you may have. If you are allowed, you may begin walking. Some things that may impact this is if you would be lightheaded, if you would be nauseous, if you would not feel good, we might have to delay the walking. But the goal is to get you up and moving that first evening. We will start a few exercises, basic exercises, some ankle pumps, quad sets, glute sets, and all of these we can go over in your prehab evaluation. For your safety and to prevent falls or additional surgery, please do not get up by yourself while you're in the hospital. So the nurses are wonderful, and anytime you need anything, press your call bell. Any staff member who is walking by can assist you or get the right person to assist you with your needs. When you first get up after surgery, you are hooked up to a lot of things. You might have your leg pumps on. You may have an IV. You may be hooked to oxygen. There are various lines and tubes that may get in your way. So for this reason, and for the reason that you may get lightheaded, dizzy, or not feel good after anesthesia, we will always be with you the first time you go into the bathroom. As you start to become stronger, we may stand outside the door, but you'll never be up and on your feet alone throughout your stay in the hospital. This is our therapy gym in the top left-hand corner at the WellSpan Surgery and Rehabilitation Hospital. We have mat tables, there's stairs, there's curb steps, and there's even a car out back that we can simulate whatever you have to go home. In the bottom right-hand corner, that is our therapy gym at York Hospital. It has the same thing, the stairs, the mat table, the car simulator, kitchen, laundry facilities, everything is available to simulate so you feel comfortable going home. This is where if you take those measurements and you tell us, this is what I have at home, we can practice and hopefully get you ready and prepared to go home. After surgery, you will have both physical and occupational therapy. Physical therapy will be the walking, the stairs, getting in and out of bed, and doing your exercises. Occupational therapy will go over those activities of daily living. Everything is individualized to your care. So if you have questions, feel free to ask us. We'll do our best to work on solutions with you for going home. Our goal is to help you achieve your goals. A lot of times that involves patients wanting to be as independent as possible with their activities of daily living. With this, an occupational therapist will help you with dressing, bathing, showing you how to manage your walker in the kitchen, and maybe even getting in and out of your vehicle. An occupational therapist will bring these pieces of adaptive equipment with them during your treatment sessions. They might be useful if you have hip precautions or if your knee is stiff or painful after surgery. The first piece there on the left-hand side is the long-handled shoehorn. This piece of equipment is good for getting the backs of your sneaker or your shoe on your foot. Up in the top right-hand corner is the reacher. So this item is good for grabbing things that may land on the floor, as well as those for hip precautions who need to reach their feet and need a way to put on their pants. This piece of equipment, you could grab your pant leg, thread your foot through the one side, then use that reacher to thread the other leg through. In the bottom there is the sock aid. So this sock aid is a way for getting your socks on without having to reach your foot. You take your sock, you put it over that white plastic sleeve, and then you take the handles, you put the device on the floor and pull those handles up and around your foot to put your sock on. There are also different options for your bathroom. So looking at your toilet today, if you feel like after surgery you may need a handle to pull up from or push from, or even some height if you have a lower toilet, these 3 toilet options would be right down your alley. So the first one is the 3-in-1 commode or the bedside commode. This device goes over the toilet, or you could put it beside your bed, put it on the first floor. There's a bucket attachment that goes in the bottom so that it's easily able to be emptied and then brought back for your use. It's nice because it has both handles you can push from. It has the elevated seat so that you could stand a little bit easier from that device. On the right-hand side, there's the raised toilet seat with and without the armrest. So thinking about your toilet at home, do you have an area where you can push from? Is the sink close by that you can push from that to stand? Or do you feel like you might need those armrests to push up from? If you already have something, that middle option is perfect. Use the windowsill or the counter. Some of you may already be doing this at home. But that raised toilet seat height will make it easier for you to get up and down. Now, all of these options, the bathroom equipment that I've gone over so far, 9 times out of 10, they'll all be out-of-pocket costs. So when you're here, if you say, hey, Ashley, I think I'm going to need this, or you tell your occupational therapist, I'm having issues with this before surgery, and I think I may need something like this, we can make sure you get what you need when you're here. There is a price list for all of these items that you can buy and purchase, and then what happens is you'll just be sent a bill in the mail to pay. After surgery, we will recommend that you use a rolling walker when you go home. So this we will practice with you while you're in the hospital. It's the type of device that has 2 wheels on the front and 2 posts in the back. So this device is great because when you're having more pain, if you push straight down towards the floor on the walker, it will not move. Another benefit is that as you're walking and you're needing less support, you can just roll along and get your normal step over step walking pattern back. A lot of times people ask me, Ashley, what about a walker without any wheels? Isn't that more supportive? Unfortunately, when you use a walker without wheels, you have to pick up that walker and then place it again. When you do that, anytime you have your walker not in contact with the floor, it puts you at a risk for falls. When you put it back on the floor, then you have to take a step, and it's a more robotic way of walking. So you pick it up, you take your step, pick it up, you take your step. With this walker, you can get a nice normal walking pattern as you start to progress. Another question I get a lot is, can I use a rollator? So a rollator is a 4-wheeled walker with the hand brakes and the seat. Yes, it has lots of benefits and it's nice to have an area to put things. Unfortunately, after surgery, when you're in more pain, you will need the support and the ability to push down on that walker and not have it roll away from you. So right after surgery, this rolling walker is the device we recommend. Now, if you have a walker at home or you're borrowing one from a friend, you picked one up at a yard sale, whatever the case may be, please bring that device in with you when you come in for surgery. So that way we can see that it fits you, we can make adjustments, and you're ready to go home with your rolling walker. Finally, a question I get is my walker covered by insurance? So my short answer is it depends. It depends because insurances a lot of times will cover one walking device every 5 years. So that might be a walker, a cane, a wheelchair, crutches. So anything in the past 5 years that you can think of that has been run through insurance, and any of those devices may prevent you from getting a new device when you're here in the hospital. The case managers are a good touch point and can help you get assistance with what device may be covered after surgery. When standing with use of a walker, make sure you always push from whatever surface you're sitting on. So put your hands on your bed, on the armrest of the chair, and make sure you scoot to the edge and then use those arms, your strong non-surgical leg, and as much weight as you can tolerate in your surgical leg and push to stand up. Once you're standing, that's when you grab hold of your walker. You never want to pull up with your walker because that walker is not as stable as it looks and it has a chance to tip back on you. Now do the opposite when you sit. You want to come back, have both of your legs touch the chair or the bed where you're going to sit. You can put your surgical leg slightly in front of you to take some pressure off of that knee or hip, and then reach your hands back for those armrests for your bed and sit down nice and slow. If you have stairs when you go home, we will simulate that. So whatever your needs are, we will do here while you're hospitalized. If you have one step to get in from the outside, that's that first picture there on the left. You are able to use your walker. So your walker goes up or into the house, and then you'll step up with your strong leg, followed by your surgery leg. In the picture to the right, if you have a few steps to get in your house with a railing, we will simulate that. Or if you have your bedroom is up on the second floor, we will practice that full flight of steps. With the sequential steps, we usually recommend that you use the railing and then some sort of support in that right hand. So in the picture, we give you a cane and you would be able to offload your surgical leg a little bit easier. So you, again, go one step at a time, up with your strong leg, followed by your surgical leg. As you come down the steps, you'll take that cane and then followed by your surgical leg and then your strong leg. So you want to go up the steps with your strong leg and always come down the steps first with that surgical leg. Finally, we will practice the car. So this is the most important part because this is how you get home. We can practice with our car simulations we have, or we can even practice with your own car. So if you're going home in a truck or an SUV, please bring that in. Your loved one can bring it in, and then we can practice that height for you to go home. You will want to back up to the car, sit down, scoot back, and then bring your legs in. We don't recommend that you step over the car or over the threshold to get into your car. You always want to sit down first and then bring those legs in. During your in-person prehab evaluation, we will go over your hip or knee replacement exercises. They are located on section 4 on page 14. We recommend that you start them as soon as possible after your prehab evaluation so that you start to build up some muscle memory before surgery. This will help you move your leg through those range of motion after surgery when you might have a little bit more acute pain. So right now, we recommend that it's within the pain-free motion. You don't need to push through your pain to achieve these exercise positions. Please get guidance from your physical therapist during your prehab evaluation. I'm sure as you were listening to this presentation, you may have thought of some questions to ask me in person. Please write these down in your joint binder, and we'd be happy to answer them with your next care team provider. I truly appreciate you taking time to listen to this presentation. I look forward to the chance to meet you in person after your surgery. Until we get to meet, please stay healthy, take care of yourself, keep moving as able, and thank you for choosing WellSpan Health for your total joint replacement needs.